As many as 75% of women will experience pain during sex at some point, according to the American College of Obstetricians and Gynecologists. While some women may experience pain infrequently or just once, for others, it can be a persistent issue. Painful sex, or dyspareunia, is not a normal or acceptable part of sexual activity. Even if pain is occasional or mild, it should be addressed, especially if it impacts your sexual enjoyment or overall quality of life. Dr. Karen Ailber notes that pain during sex is a concern whether it is mild or severe, and women should feel encouraged to discuss it with their healthcare provider. Sex should be a pleasurable experience, and if it isn't, there's no reason to accept it as normal. Intense or frequent pain should prompt a conversation with your doctor. Addressing sexual health is important, though many women may feel embarrassed about discussing sexual problems. Dr. Ailber emphasizes that sexual health, like mental health, should not carry stigma. Normalizing conversations about sexual health is crucial for effective care and treatment. One common cause of painful sex is dryness, which can affect women of any age but is more frequent in perimenopausal and postmenopausal women. Dryness can disrupt the vaginal balance of good bacteria, leading to infections that contribute to pain. Causes of dryness include birth control use, breastfeeding, and menopause. Using a personal lubricant can help alleviate pain, and studies have shown that it can enhance pleasure. Dr. Alexandra Dubinskaya advises that personal lubricants should be selected carefully, considering ingredients and potential irritation, and should be used without assuming that lack of lubrication means lack of arousal. Beyond dryness, several conditions can cause pain during sex. Endometriosis, for instance, is where tissue normally lining the uterus grows outside it, causing pain that can include painful intercourse. Interstitial cystitis, or painful bladder syndrome, is often mistaken for a urinary tract infection due to similar symptoms but is actually a non-infectious condition. Pelvic floor dysfunction, where the muscles become too tight, and pelvic floor injuries, such as those from childbirth or certain activities, can also cause pain. Infections, whether bacterial, yeast, or sexually transmitted, often accompany other symptoms like discharge. Ovarian cysts can be asymptomatic but can cause pain and bleeding when they rupture. Painful sex typically has a treatable cause. If you find yourself avoiding sex due to pain, it's essential to see a doctor, with a gynecologist often being a good starting point for diagnosis and treatment. Many women are reluctant to discuss pelvic issues, which can make these problems seem more mysterious. Dr. Ailber notes that self-blame can exacerbate pain and sexual dysfunction. Increased openness and access to resources can significantly benefit women dealing with these issues.